Keith Radbill, and I'm your healthcare consultant for Docuvitals. I wanted to take this opportunity to thank you for choosing Docuvitals as your remote patient monitoring service provider. Remote patient monitoring and the virtual office is really the wave of the future. As we've seen in 2020 with COVID-19, we as physicians really need to properly care for our patients outside of the traditional office setting. Really, remote patient monitoring is the next evolutionary step in offering that service to our patient. It ensures that they receive the continuity of care that they deserve, while at the same time reducing overall healthcare costs and improving quality of care. One of the things that sets us apart as a remote patient monitoring provider is that Docuvitals, we supply the software, the monitoring devices, and we provide clinically trained and qualified clinical care coordinators to monitor your patients for you without your practice having to pay any upfront implementation costs. We offer a complete turnkey service that provides training for the physicians, the staff, and the billing personnel, all for you. Remote patient monitoring, or RPM, is endorsed by Medicare and other payers because it has really been proven to reduce overall costs and improve healthcare outcomes. Not only does remote patient monitoring reduce hospital admissions and emergency room visits, it also has been proven to improve medication compliance among patients. And this has been demonstrated in a KLAS research report, which I'd be happy to provide for you upon request. Not only does Docuvitals' remote patient monitoring program relieve the workload for you and your staff, it's really simple and easy to use. With the click of a button, the patient's blood pressure is uploaded to Docuvitals within minutes, where the data is monitored by our clinical care coordinators pretty much every day. Docuvitals connects directly through a SIM card into the cellular network, so there's no need for Wi-Fi. It's basically completely mobile. Like I said, there's no need for Wi-Fi. So if your patients, many of them who are going to be elderly, some may not have Wi-Fi, there's no need for it, no worry for it. Their readings are going to be sent to us almost immediately. So remote patient monitoring is really the wave of the future, and with Docuvitals, your practice can continue to adapt to the constantly changing healthcare landscape and ensure that your patients are able to receive the continuity of care that they need and deserve, in addition to providing your practice the ability to continue to thrive. Not only am I a healthcare consultant for Docuvitals, I'm also a patient. So I wanted to demonstrate how really great and simple this whole process is. So I'm going to grab my cuff. Hang on. This is a very simple system. You have the cuff here, which is attached right there. And the cuff has a wire. It's Velcro, obviously. It has a wire. The wire should be facing downward when the patient just slips their arm through. And remember, your patient shouldn't be wearing a shirt. So, assume that I'm not wearing a shirt. And after they put their arm through, like I said, the wire pretty much in the center of the arm facing downward. There's a little word that says ART, which is short for artery. That should go over pretty much the middle of the arm. And all they have to do is pull to tighten it. That's simple. Push the button, and it's red. You want to tell your patients that their arm should be at the same level with their heart. They should be relaxed. And we'll see what my number comes out. Last time it was a little bit high. So, okay, so a little bit up. But, one thing I do want to remark about, it's actually fairly comfortable. Some cuffs will automatically go really, really above the systolic number when squeezing. And that can go, sometimes I've seen them go above 200. This one really doesn't do that. It is very comfortable and pretty much completely painless. As far as what I feel this can do for my patients, again, every single one of my patients that has hypertension, I give one of these cuffs to. And I have personally found that it's helping immensely. I think it's underestimated how much value there is in remote patient monitoring, especially with blood pressure. several examples. Many patients, as you know, they say to us, well, my blood pressure's up in the office because I'm under stress. I ran up the steps. I had too much caffeine. I'm in a lot of pain. And now we can say, all right, maybe that is so. Take this, let me look at your blood pressures at home. And now they see numbers that are objectively possibly elevated. And it reinforces just what you're trying to tell them, that they have high blood pressure, it may be a strain on their heart, and they need to take their medicine. And they will take their medicine. The other side of the coin, and I have seen this more than once, is a patient coming in where their blood pressure is elevated on every visit, and they tell me that it's normal at home, and they bring the cuff home, and sure enough, their blood pressures are pretty normal. So it really gives validity to that white coat hypertension, although that is not very common, but it does happen. Again, it's very simple, very safe. I love that the system averages out my patients' blood pressures each month, so I can see what their average is for January, for December. I can see their numbers on a graph, if they're getting peaks at a certain time of the day. The communication back and forth between the care coordinators is really invaluable. They may instruct the patient on, are you sitting down when you take your pressure? Are you relaxed? Did you have a salty meal? Your blood pressure was up. And remember, the care coordinators will communicate with your patients via text, via phone, and the communication can go both ways. The text may come back from the patient, well, I just had surgery and that's why my blood pressure's up. So all these things really are valuable in the treatment process. If you have any questions or you'd like to find out more about our finance revenue model, please give us a call at 833-568-5909, or you can email us at info@docuvitals.com.